Good evening, everyone. I'm Dan Hogan, your host for Centel Spotlight, and they always manage to put me in the most unusual place. And today, our show is all about the annual health fair here at Winter Haven Mall. And next to me is Nancy Condon. And tell me, what is this thing I'm in?
This is a rotor rest treatment table.
And as the show progresses, we're going to tell you more about that, so please stay tuned. Well, Nancy, first of all, give us your title, if you will.
I'm the Assistant Supervisor for the Surgical Intensive Care Unit at Winter Haven Hospital.
And give us some more information about what I'm in here and how this affects patients.
All right, you're on a rotor rest treatment table, and what this does, it keeps the lungs clear, the circulation good. We're made to move, and people that are immobile from a spinal cord injury or trauma or whatever need to be moved somehow, and this is an excellent way to move it. Move the patient back and forth with a motor continually, and then there are hatches in the back that we can give you care to your back and whatever and take good care of you while you're moving.
And is there an average time you keep someone in this?
Depends upon the problem. For the spinal cords, they're usually on it at least a week or longer for the really bad, accidents. We're trying to prevent it, though. This is what we want. We're here. This is mainly so everybody can see how we treat people on a bed that have this injury, but we want to prevent it before it happens. We want them to not dive into shallow water. We want them to use their seatbelt, buckle up every time, and this is why we're here.
After they removed me from that special bed, I walked over to another booth and spoke with Jane Houston, a representative of the American Cancer Society. First of all, what are we doing at this particular booth?
Well, this is a screening for skin cancer. We have two dermatologists here, Dr. Warner and Dr. Vale. And the people line up, there's no charge. And if whatever their problem is, they'll tell him about it, and he'll look at it and let them know what their condition is, if there's any signs of malignancy or not. That's primarily what they're doing, just skin cancer screening.
Okay, and I understand that this is Cancer Month. What can you tell me about that?
Well, once a year we have a month set aside to raise funds for cancer. And April is Cancer Month. And I've been telephoning for the month of March, trying to line up volunteers to go through the different neighborhoods to get people to go to their neighbors and ask for donations. This is one of the big ways we have of raising money for cancer.
And if you will, tell our viewers, if they want to contribute, how they might get in contact with you or the proper people to make a donation.
Well, the best way if they want to contribute, either give to their neighborhood volunteer who will knock at their door, or they can send a check to the American Cancer Society at 634 First Street South.
Next, we went into one of these skin cancer screening booths where Dr. Victor Vale told us what specifically was being checked.
We checked their exposed parts of the body, the face, the hands, and the arms, to make certain that they don't have any lesions that are either potentially dangerous or actually dangerous.
Right now, Dr. Vale is going to examine me, and let's see what happens here.
Okay. You need to look at your arms,
all right,
hands. You have a few pigmented areas here which are normal. These lesions are not cancerous lesions. These are moles, or nevi as we call them, and you have a few freckles, but these are within normal limits. And you have a few more unusual looking moles over here, but these two are within normal limits. So basically you don't have anything we have to be immediately concerned about here. But because you have many of these brown lesions, they should be checked by yourself at least probably about once a year.
Okay, now let me see if I can find my big one here. Where is it? There it is.
That you've probably had since childhood. And,
I most certainly have.
Yes, and that's a pigmented, what we call pigmented hairy nevus. And those are congenital lesions that usually occur shortly after birth or right after puberty, and they stay with the person most of their life. If they change in color, size, or shape, and anything, or they bleed, then they should be removed.
Okay, let's check the face here, doctor.
Okay. Well, you have a number of pigmented lesions on your face, and some of these are slightly red, and some of them are reddish brown, and some are normal skin color. And as I look at your face right now, most of these lesions appear within normal limits. You have a few little flat brown lesions, which we call lentiginous, and these will probably increase in number and possibly in size as your sun exposure increases. So as you get more of these lesions, you needn't be concerned about them. They're sort of like freckles that don't go away. But you don't have any areas that, you don't have any lesions on your face right now that appear to be skin cancers or potentially skin cancers. So you don't have, you haven't had too much sun exposure at this point to allow you to develop lesions that are going to become obviously skin cancers at a later date. But you do have multiple nevi, which need to be checked on a routine basis at least once a year by yourself. And if you notice any change in these lesions, then they should be checked by a physician to make certain that they're normal.
Now, let me ask you this, if I may. Here in Florida, of course, a lot of people come down to specifically go out and get a suntan. And what do you recommend as far as time exposure in the sun?
Well, that varies with the time of the day and the time of the year. But if you're talking about, say, between the hours of 10 in the morning till, say, 4 in the afternoon, then I recommend limiting your sun exposure to about 1 hour or less, unless they tan very easily and very well. And depending on the type of skin color you have and how well you tan depends how long you're out in the sun. Generally speaking, though, for fair people who are going to be out in the sun for more than an hour, they should use a sunscreen to prevent burning and prevent sun damage. And the type of tumor that we see most frequently down here is a skin cell, a skin basal cell carcinoma, which is the type that's directly related to sun exposure. Of course, the type that's more dangerous is the melanoma. And both of these are directly related to the amount of sun a person gets throughout their lifetime. And this is not to be construed that you don't start worrying about these things till you're 40 or 50 years old, because the sun exposure is a continual thing, and it's accumulative, just like X-ray exposure is. So the more sun we get, the more cumulative damage we're going to have to our skin. And we want to avoid that when we can, and if we can't, then we want to use a sunscreen. So people that have to be outdoors, they should use a sunscreen if they're fair. And if they want to be outdoors for recreational purposes for long periods of time, they should use a sunscreen too.
After talking with Dr. Vale about skin cancer, we stopped by the booth that featured a free blood pressure check and spoke with Dave Sargent.
I'm just going to check your blood pressure now, okay? Measuring here is the pressure of your blood as it flows through the artery in your arm. Okay.
Now I'm going to guess and say it's going to be high because we're in front of the camera lights here. And you're always more nervous on television than in real life, or so they tell me, so we'll see how we came out here.
You're right, it's high.
Okay.
It's a little high. You might want to check it out, actually.
Okay. Now, again, at what point are people suggested to check it out? In other words, when are we in a range where they should have their blood pressure checked out further?
Okay. Yours here is 150/102, okay? We're looking mainly the norm person, the fictionalized person who walks, John Q. Public, walks down the street, should be about 120/80. But the systolic, which is the first number, goes a little bit higher. It fluctuates. The second number, however, should not go over 90. 90 is your borderline. We have a system here where we double check with some of the registered nurses from Winter Haven Hospital.
After checking on my blood pressure, I decided to get my mouth checked next, and Winter Haven dentist Lon Muncie helped me do that at the oral screening booth. He's got his rubber glove on. He's going to check my mouth here, and he's been in dentistry here in Winter Haven for 29 years, so I presume you know what you're doing.
I hope so, yes.
Okay, what are you going to check for?
This is just a screening of the soft tissue to detect any lesions that might be from visual observation and also from palpation of the tissues. We do not have the dental x-ray or the dental light, which would permit us to check for cavities, but this is just soft tissue screening.
Okay, do what you got to do and kind of talk us through it, if you will. I suppose I have to open my big mouth now?
Yes, sir, I'm afraid you will.
Okay.
Hey, no problem, a lot of room. We're just palpating the soft tissue through the cheeks and the lips to detect any abnormalities as far as hardness of the tissue, any elevation of the tissues. We also, with the aid of the little light, not a dental light, but the little flashlight does give us a good observation there of any change in color in the tissue. If there's any red, inflamed tissue, then it would be a suspicious area. But since you go real regular to have your teeth checked, cleanings done, this gives the dentist an opportunity to check for any abnormalities in the mouth. And looks like they've been taking real good care of you, because I see nothing that's abnormal.
Well, it was good to hear that my mouth was okay, and speaking of hearing, that seemed the next logical thing to have checked. And Bell-Tone hearing aid specialist Ron Braswell conducted the test for me.
We'll put these earphones on your ears, and you're going to hear some little beeps. I want you to acknowledge by nodding your head when you hear the beep. All right, we'll do your right ear first, then your left ear, but I'll tell you when I'm going to switch.
Linda Alice, please come to the Hickory Farm. Linda Alice, please come to the Hickory Farm.
All right, now we're going to go to some low tones, and they'll get lower and lower as I decrease the volume. You can hear that? You got good hearing.
Well, after getting that good news, I decided to stop by the vision screening booth. I'm talking here with optometrist John Tivnan. He's also here with his partner, John Davidson. They're both in practice here in Winter Haven. If you will, just talk me through this test and tell me what to do here to get my eyes checked.
We'd like you to just first carve this over your left eye. And I want you to look way out at the screen and try to read that bottom line for me.
Okay, now, first of all, I'm looking at two charts. Which one are we talking about?
Take a look at the chart on the left-hand side.
Okay, the bottom line is I see it, Z, G, E, V, R, N, D, O, S.
Very good. That one's fine. Now
Okay.
we'll cover the other eye. Let me give you... I'll try reading the bottom line here.
Okay, the bottom line again on the left screen. Okay. Y, H, T, P, G, N, 2. Either a 6 or a 5 there.
Okay, we'll pass you on that one.
Okay.
That means your vision is at least 20/25. So with the rules of our screening, you've passed. So we don't refer you on for further checking. Now, if you had not gotten 20/25 or better, we may have sent you off to your doctor, your optometrist or ophthalmologist, to see whether your vision could be improved.
Okay. Another eye test being conducted at the health fair this year was the one for glaucoma, and registered nurse Barbara Smith told us about the procedure.
Don't put a drop in each eye, and the drop numbs the eye while I test you.
Okay.
You won't feel a thing.
They always say that.
Close. Keep them closed till they stop tearing.
Okay. I like to cry a lot.
Any
This could take
stinging or
days.
anything, you just keep them closed.
Okay.
Open. If they feel okay, leave them open.
Okay. I still feel like I've got liquid in there. Can I do this?
You can
Okay.
touch gently. Okay, Dan. Now the secret of this is simply to stare straight ahead. Okay? And you're going to stare either
At her.
or the picture of the girl and boy straight ahead over there. See that?
Yeah, I do.
Okay, now you need to move that a little.
All right.
Now you need to stare for me, and I mean really gaze at that pretty picture over there.
All righty.
Real good. Now, stare with the right eye, because I'm going to get in front of you a little bit. Keep that right eye open and stare. We got to regroup.
Got to regroup.
Okay, now you're going to stare, and I'm going to hold you a little bit better, but you got to open that right eye.
Open that right eye.
It controls that left with me getting in front of it. It's hard, okay? You got to kind of psych yourself up to do it.
Psych myself up for that.
Stare, stare, stare. Okay, you're normal.
You're the first person that said that today. Perhaps in my entire life.
Your eye pressure is okay. Okay, you want to do it again every year.
Okay.
And the only thing you need to remember is that your eyes numb for about an hour from that drop.
All right.
And don't do anything to hurt yourself.
Am I going to cry a lot for the next hour?
You're going to feel wet, maybe a little heavy.
Okay, I've felt heavy for years. You ask on there whether a blood relative has had glaucoma. If that's the case and you test someone here that has a blood relative with glaucoma, even though the patient you're testing is okay, what is the recommended procedure from that point on with the relative in the family that has glaucoma?
The ophthalmologists tell me to recommend, as I go around the county, if you have a blood relative every year, from now on.
Mm-hmm. Get the test then.
Get the test. That's all you need to do, just a spot check. That's safe.
Mm-hmm.
If all your answers on that card are no, we say every 2 years.
Okay.
No
Very
blood
good.
relatives in every couple of years. And you'll find people down here to the health fair today who are going to their doctor next week, or they just went last week or last month. And they're, just because we're having a health fair, they're doing it. A lot of them don't realize that they have a glaucoma test when they have their eye exam.
Mm-hmm.
And that's something, we want to get across to people.
While at the health fair, I decided to go all out and get myself checked from head to toe. Now we're going to get my feet checked by a podiatrist, Dr. Alfred Arnold. He's from Lakeland. And if you will, just talk us through this test and what you're looking for here today.
We're basically doing a very general test. We check circulation patterns, we check the nerves, we check the coloring of the skin. We also ask the patient if they have any particular pain, and if they do, we give them some rough idea what may be contributing to the pain, what causes them, and what we would recommend to go to their own podiatrist to get help for their problems.
Okay, and what do you see here regarding these 2 feet?
I see 2 good-looking feet.
That's it, Doc? Really?
No problem. Everything looks fine. Good color, good temperature, no pain.
Okay, well, I appreciate hearing that, of course. Now I'm going to ask you a very basic question here. The other night I put on a new pair of shoes and got my traditional blister either on this foot or this foot. I can't tell which one, but what causes that? It seems when you get a new pair of shoes, chances are you might wind up with a blister or 2.
Right. New shoes generally have pretty stiff counters in the back, and before they're broken in, those counters will rub up against the sensitive tissue back there, creating blisters. What you should do is simply mash that counter a little bit and get it softened up. Then when you do wear the shoe, it won't be so irritating.
Okay, something else I want to know is when you get a blister, what exactly happens there? You wind up with the moisture. Where does that come from, and what makes the blister form?
Moisture is a form of serum that comes from the blood itself. It builds up a blister to protect the deeper underlying tissues, and it fills up with that serum derived from the blood.
Okay, now let's say someone has gotten a new pair of shoes, gets a blister, and it doesn't break. Do you recommend they go ahead and break it?
Right. You get a needle and sterilize it over an open flame, and then just slightly prick the blister and drain out the fluid and paint it with any good antiseptic, methylated mercurochrome.
What are some big problems people might come to you for?
We see problems with bunions, joint deformities, hammer toes, infected ingrown nails, arch problems, children's problems with feet not forming correctly are the main things that we treat.
And speaking of ingrown nails, what can someone do to prevent that?
Cut the nails straight across, never cut down on the corners of nails, and just keep them cut properly is the main thing.
Okay, how are your feet? I'm curious.
I have bad arches.
Okay.
Bad feet.
Is that what inspired you to become a podiatrist?
That's right. I wanted someone to help me.
Once I got back on my feet, I proceeded to the clinical laboratory booth where they checked your blood type and told you whether or not you were anemic. I spoke with Robbie Taylor, a medical technologist. First of all, how do you get the blood from these people?
Okay, all it entails is just patients having their fingers stuck. It's just a little prick on the end of the finger, and we put some blood in a solution to check for the hemoglobin. Then we put it in 3 tubes, add some antisera to it, and check the blood type.
And how long does the test take?
It takes about 3 minutes.
Well, I had 3 minutes, so I let them take a sample of my blood from my finger, and I found out after the test was over that I was not anemic and that I had a common blood type, O positive. Now we're at the orange juice booth here, and a couple of candy stripers are on each side of me, and and we're going to talk here with Karma Jacobs. And first of all, what does a candy striper do?
Do a lot of odds and ends jobs at the hospital, like fold up sheets and towels in the emergency room, give flowers, cards, do a lot of things that nurses don't have time to do.
And what is the age range of candy stripers?
14 to 21.
And I assume this is volunteer work. You don't get paid for it, is that correct?
You don't.
And what are you doing here? Simply giving out free orange juice today?
Yes. We had to give out orange juice for the blood test.
I see.
After the blood test, they have to have orange juice.
Mm-hmm. And why is that?
Because it takes a lot out of them. I don't know. A couple of ladies fainted, so they gave them orange juice.
Right now, we're speaking with Karen Hall. She is the Patient Education Coordinator at Winter Haven Hospital. And first of all, what do you do for the patients in the hospital exactly?
I coordinate the resources that we use for inpatients to help them learn about their conditions and home management, particularly for people who have chronic conditions that need to know how to manage diabetes, heart disease, that sort of thing at home, and also help the nurses in their patient teaching efforts in-house.
And what do you do as far as the community is concerned? How do you help educate the people in the community?
I teach the weekly diabetes classes we have at the hospital for people out in the area, and I help to coordinate the annual health fair. And I also sometimes speak to groups out in the area on various topics, and I teach CPR and etc.
Now, if a particular group would like to have you speak for them, how does that work? How do they get in touch with you? And is this something that is done at no charge, or is there a charge?
It's through the hospital, and they would contact me through the education department. Now, I'm certainly not an expert on everything. Sometimes I can find resource people for them.
We're speaking now with David Libby. He's Assistant Administrator for Winter Haven Hospital. And how long have you been having this health fair?
We've had the health fair on and off for about 7 to 10 years. We've been consistent with it for the last 3 years. We've processed approximately, I think, a little over 1,000 people last year, about 900 the year before, and we anticipate probably around 1,200 this year.
As you can see by our visit to the health fair here at Winter Haven Mall, that all of these people going through these tests are trying to keep their bodies in shape. And right now, I'm going to see how badly my body is not in shape. Well, that's our show. This is your host, Dan Hogan, warning you this is what you'll look like if you don't stay healthy.